repeating again. To block whole of the pinna, you have to block the greater auricular nerve, lesser occipital nerve, auriculotemporal nerve, and auricular branch of the vagus nerve. The auricular branch of the vagus supplies this much part of the pinna, right? And this much part is supplied by the great auricular nerve, and this part is supplied by the lesser occipital nerve, and this is again supplied by great auricular nerve. There is some doubtful innervation on this lower part by the glossopharyngeal nerve, but this is again doubtful. And this part is supplied by auriculotemporal nerve. So I want to block this cervical plexus to anesthetize the great auricular along with lesser occipital. So this is the posterior border of सिर उठा बेटा थोड़ा सा बस see sternocleidomastoid here. You can notice the external jugular vein here. So I am taking the 5 ml of local anesthetic solution, and this is the sternocleidomastoid. थोड़ा उठा बेटे बस right. And this is the external jugular vein. एक छोटी सी सुई लगेगी बेटे, एक हल्की सी चिट्ठी काटेगी बस. Now be careful while injecting. Just go up, don't inject it. Just wait for some time and then advance the needle up along the posterior border of the sternocleidomastoid here. I will pierce the investing layer of cervical fascia and inject 2 ml of the solution just underneath it. This will complete the superficial cervical plexus. Now, sit out of it, bas, leave it. Going perpendicularly, just pinch this and then insert the needle here. Always aspirate before injection. So I have taken only 1% lidocaine here. Lesion here, and I will try to preserve this much of the skin, otherwise it is very difficult to cover the defect. And this is basically the starting point of the dumbbell sepet of keloid. See, the part is projecting here also, so we will excise this much part here. I try to preserve this much amount of the skin to cover the defect. So starting from basically this is a sort of intrakeloidal excision. So it is relatively bloodless because of. So try to pour out the lesion from here. Is still there, so we will pour out from here also. Avascular field, we have preserved the pinna. Now we will core out this portion. See? We have excised this lesion into two, except leaving behind a small margin here. See? Clean. It's just like that here. So we have removed. Now we have left very small margin here, just a millimeter of the margin and about a millimeter margin. We have used this flap and we have injected the small dumbbell part of the keloid from this outer aspect, and now we will fix it up, and in follow we will like to inject a few more injections of triamcinalone, which I am going to excise here, right? So this has to be excised. Dog here from this area to smoothen out the suture line.